Hi, everyone. Welcome back to another episode of CHD Unpacked, a podcast about living with congenital heart disease. This podcast is brought to you by the Canadian Congenital Heart Alliance. I'm your host, Amanda, and today we'll be unpacking the topic of CHD and neurodevelopment. We're very honored to be joined by today's guest, Dr. Stephen Miller. Dr. Stephen Miller is head and professor of the UBC Department of Pediatrics and the chief of pediatric medicine at BC Children's Hospital. He is a fellow of the Royal Society of Canada, holds the Hudson Family Hospital Chair in Pediatric Medicine, and the James and Annabelle McCreary Chair in Pediatrics. He was also previously a Canada Research Chair in Neonatal Neuroscience. Leading a multidisciplinary team, Dr. Miller's research program focuses on better understanding how intensive care impacts brain development and injury in the newborn, with a focus on those born preterm and those with congenital heart disease. The goal of his team's work is to promote strategies to prevent brain injury and promote recovery, with the ultimate goal of improving the lifelong health of children and their families. Please join me in welcoming Dr. Stephen Miller. Hi, Dr. Miller. Welcome to CHD Unpacked. Thank you so much for joining us today.
Thanks so much for having me, Amanda.
So just to start off, today we'll be talking about CHD and neurodevelopment. Can you tell us a little bit about the scope of your practice?
So I'm a neonatal neurologist, which means that I care for babies where there's a concern about their brain. And I follow children through childhood and their youth to support their developmental outcomes over time.
Great. Thanks so much for sharing that. Just to kind of kick off the episode, can you tell us a little bit about what neurodevelopment is and how it's defined?
So neurodevelopment refers to a person's developmental skills that are related to the brain. And so that includes things like cognition or thinking skills, language development, memory, behavior, and motor skills and motor function related to the control of movement from the brain.
I think that's a great definition to keep in mind kind of as we go through the episode. And so kind of speaking to that definition, can you then explain how a neurodevelopmental condition might occur and how it might be diagnosed by a physician?
Yeah, so I think it's helpful to use some of the clinical terms that are associated with these neurodevelopmental conditions or neurodevelopmental disabilities.
Mm-hmm.
So common neurodevelopmental disabilities that are seen by neurologists are conditions like cerebral palsy, which refers to an impairment in motor skills related to an early life injury to the brain. Other developmental disabilities include things like attention deficit, hyperactivity disorder, ADHD, or autism, or developmental coordination disorder. And so these conditions are often very variable. They very often coexist. So children with cerebral palsy may have normal language development. They may also have impairments in their language. And so that the issues really depend on the cause of the developmental disabilities. Common conditions for us as causes are things like brain injury. So a lack of blood flow or oxygen to the developing brain will lead to an injury in the brain. Stroke. People are often very surprised to learn that the single most common time in your life to have a stroke is the day that you're born. So strokes are not uncommon in babies.
Right.
And then there are a host of genetic conditions that lead to neurodevelopmental disabilities.
And how might someone be diagnosed, and what's kind of the timeline for a diagnosis to occur if someone has a condition like this?
Yeah, so a great question, and one with many answers. So neurodevelopmental disabilities manifest in different ways across different ages. So babies that have had an early life brain injury might show differences in their motor skills early on that suggest a risk of cerebral palsy, for example. But the diagnosis of cerebral palsy usually happens closer to a child's second birthday, as one example. When we think about cognition or thinking development, because there are limited ways to assess that clinically in babies, we often have to wait for children to be manifesting those skills. And so it's the absence of the typical developmental trajectory that would signal to a clinician a concern for a neurodevelopmental disability.
Okay, so you would kind of look at what we would typically expect a child to kind of manifest in terms of their development and their speech, their motor skills, and then you kind of compare that to what they're actually displaying over
Exactly. You said it much better than I did. And
time.
then neurologists clinically assess children doing a neurological exam at the bedside. And so that assesses things like a child's eye movements and vision, their tone, their motor strength, their reflexes. And that helps to inform both the type of neurodevelopmental disorder and also the child's function.
Okay.
Through this, I think it's also important to point out that neurologists are only one of the healthcare providers that care for children with neurodevelopmental disorders. Pediatrics, we have general pediatricians, developmental pediatricians, neurologists. It's broader than pediatrics, orthopedic surgeons, and then many other healthcare professionals, occupational therapists, physiotherapists, speech and language therapists. And so I want to be sure that there is an interdisciplinary approach to how we support children and families with neurodevelopmental disabilities.
I think that's a great point to highlight for families if someone's listening and their child was recently diagnosed with a neurodevelopmental condition, just for them to know that there will be multiple levels of care available to them to look after their child.
Yes, and that it's good to speak with their healthcare providers. Their primary healthcare providers, their family doctors or pediatricians, or their subspecialists, like their cardiologists, if they do have a concern about the child's development, so that we're sure that the right supports are put in place as early as possible.
For sure. And as you were mentioning cardiologists, I think we'll just kind of switch gears to talk about congenital heart disease. In a child with congenital heart disease, why might they be at a higher risk of developing a neurodevelopmental condition?
Yeah, so that's a question that the answer to which has really changed over time. When I started in this career not that long ago, we really focused on the influence of a baby's heart surgery and cardiopulmonary bypass is one of the reasons why we might see neurodevelopmental disabilities over time. And with advances in surgery and bypass, we see that our areas of focus have really shifted. So as we've been able to look at children with heart disease and their families, and I want to shout out to all of the families who participate in research studies over what is very stressful periods in their lives. What we've learned is that there are several risk periods to the brain and many resilience opportunities for the brain across a child's life, even before they're born.
Okay.
Okay, so as a neurologist, I think about the developing brain in two ways. One is the brain's development, and the other is the exposure and the occurrence of brain injury. So we know that children with heart disease have a higher rate of brain injury, and that could be an injury that we call white matter injury. It's a very small little injuries to the brain's white matter or the brain's connections. Or strokes happen more commonly than in babies without heart disease. And those are the types of injuries that are seen when we do diagnostic brain imaging studies, clinically, ultrasound, MRI. But we've also recognized that the brain is developing very rapidly over this time period. And perhaps the more important determinant of a child's development is their brain maturation. And so that's what we really want to support. We now know through research studies around the world that when you have heart disease, even before you're born, there are changes in how the brain is developing. And so that those changes in brain development is what predisposes children with heart disease to be more likely to acquire brain injuries. With surgery and with cardiac care, we see improvements in brain development over time. And it's that trajectory of development that we really want to support through early intervention, rehabilitation, and supporting families and parents in the care of their children over time.
Right. I think that's really important to keep in mind kind of the two distinctions of risk that you made. And if someone is at risk and they do happen to develop a neurodevelopmental condition, are there specific types that you see are more common in the CHD community?
Yeah, so it's, I think a starting point is to recognize that the prevalence of neurodevelopmental disabilities varies dramatically across the type of heart disease that babies have. And I really want to emphasize for those that are listening that many children with heart disease flourish in their development. The concerns that we see most commonly early in life are related to a child's motor skills, and those often have some improvement over time. As children are older, we pay more attention to their language and their thinking development, their cognition. And the reason for these changes over time, involve multiple intersecting sort of pathways. The heart, the brain, and genetics. As a neurologist, I can't emphasize enough the importance of hope. And this job has really taught me to be an optimist. And so I am impressed at how children who are well supported medically, in a rehabilitation sense, by their families, progress in their development in ways that might not have been predicted from very early life concerns or what we see on brain imaging.
Mhm. I really appreciate you emphasizing the part about being very hopeful and being optimistic, because I think for a lot of families, if they're hearing that, my child has a heart condition, my child might have issues with their development, it's a lot to hear at once, and they might not have that kind of hope right off the bat, or feel optimistic about the future for their child.
And I think that emphasizes why it's important to engage in these discussions with your healthcare providers and your broader healthcare team so that we're sure to be providing the support to help promote that development.
Yeah.
The brain is so rapidly developing. It really is amazing to see this process, and for parents, amazing to watch your children develop. And our teams want to be sure that we're providing the supports that are needed to help your child develop as and flourish as optimally as possible.
For sure. And along this process, are there certain things that parents should kind of look out for when they're at home with their children, or any specific challenges that a child with a neurodevelopmental condition might have in comparison to their peers as they're kind of growing up?
Yeah, unlike many other medical conditions, which are very specific, because neurodevelopmental disabilities influence such a range of functions, it's very hard to give a specific example. What our teams will be looking towards is looking at how a child develops in their motor skills, how they're starting to express interactions with their family, with their peers, how they're using early language, and recognizing that we all develop at different rates. As individuals, we all have strengths and weaknesses. Some children, motor skills progress ahead of language skills. Other children, it's the inverse. It's important to ask questions as a child is developing if you have concerns that a child is either lagging behind their peers or siblings in specific areas.
And then in terms of kind of like the social perspective of all of this, how might having CHD along with a neurodevelopmental condition impact someone socially apart from their actual development of their brain and kind of the way that we look at it from a medical perspective?
I think this is a question about making sure that children have safe opportunities to engage with their peers
Mhm.
and have those interactions and interacting again with their healthcare team, including their cardiologists, is important to ask questions about engaging in different activities. I would point to a program by a colleague, Dr. Trish Williams at Sick Kids, I Interact North, where she's developed very specific online modules to help support parenting in the face of congenital heart disease. I think we all recognize that this is it's stressful to think about the heart of your child. It's stressful for all of the medical care that a child receives.
Mhm.
And it's important for our teams to help support families through that stressful period, because a lot of the early life social engagement is also within the home. And we want families to be able to enjoy their child's development
Mhm.
as they're supporting it.
And I think when parents feel supported, you kind of create a more positive environment for their child. There's less stress overall. I think it's kind of in a way like a positive feedback in a way that supports the child's development.
Yes, and leveraging the team, the multidisciplinary team, right, with not just the medical specialists, but the rehabilitation specialists and those in the child's environment to help support that.
Mm-hmm. And to just kind of loop back a little bit to our discussion about diagnosis, for some children who aren't diagnosed with CHD immediately when they're born, does the timing of that diagnosis have any correlation to the possibility of developing a neurodevelopmental condition?
So a great question, and one, just like some of the earlier questions, it really depends on the type of heart disease.
Okay.
With a question around timing of diagnosis and does that matter, I recognize that that question influences many aspects of this child's journey. Right? When was the heart disease diagnosed? Before birth or after birth? What was the timing of the heart intervention? What's the timing of the rehabilitation or medical interventions to support development? And the specific influence of that is very dependent on the type of heart disease. And so this is where engaging with your teams and having open dialogue becomes very important.
And you mentioned kind of types of heart disease that might influence these outcomes. Are there specific categories of congenital heart disease that might lie on the spectrum of being either high or low risk of being associated with the neurodevelopmental condition?
So most of the studies of babies with heart disease, and certainly the ones that I've been involved in, have focused on babies who have transposition of the great arteries or who have single ventricle physiologies like hypoplastic left heart syndrome. So these are the conditions that are presenting to us for surgery in the first month of life. There are many other forms of heart disease, and the complexity or the severity of the heart disease is really the most important predictor of the prevalence of neurodevelopmental concerns over time. That said, in all of these groups, there are children who do not have developmental concerns and who are thriving in their development. So I think it's very important not to hear that comment as if my child has this type of heart disease, then this is what the outcome will be.
Mm-hmm.
We know so much about the early brain development and how plastic and modifiable that is. It's really about ensuring as many opportunities as we can to support a child's development over time.
And for those that aren't as familiar with those types of congenital heart disease, would you mind explaining why they might be more associated with the risk to neurodevelopment, just based off the physiology of the condition, if someone's not familiar with it?
Yeah, so these are types of heart disease that change the way blood flow and oxygen are getting to the brain even before the child is born.
Okay.
And so it comes back to the question of how is the brain maturing and have there been any injuries to the brain? And I would say that there are teams around the world working on clinical research and fundamental science to understand how we could provide care in ways that support that brain development and prevent the risk of brain injury.
Okay. And if someone does have some neurodevelopmental issues that you're kind of noticing early on, is there any chance that they would resolve or improve, or can you kind of speak to kind of the timeline and the trajectory of how that might evolve for someone?
Yeah, so child development is so dynamic that how things evolve really depends on what the cause is and what we see on things like brain imaging and what the specific concerns are. So this is where the importance of follow-up is really important. And thinking about this as a dynamic process. We used to think about an injury to the baby's brain as a single injury with a fixed consequence. We don't think about it that way anymore. We really think about a trajectory of brain development and the importance of the everyday exposures for that child to support that period of brain development.
I think that's a great point to highlight, and a similar idea to how we kind of speak about congenital heart disease and the outcomes with congenital heart disease being so variable from person to person. And so just because you hear the words congenital heart disease or the word neurodevelopment, it doesn't mean that there's a specific outcome for your child. There's many, variable trajectories that could play out depending on the person.
And that our healthcare teams want to support those trajectories.
Mm-hmm. For sure. Can you kind of speak to some of the supports that exist for children with CHD and neurodevelopmental conditions, and how might someone get connected with some of these resources?
So I think it's important to speak to your teams locally about what resources are available, because these vary by what's available in the hospital in terms of rehabilitation services or rehabilitation centers, early development teams. There are groups that have structured follow-up programs for children with heart disease, and there are others that are able to connect families to what's required in their communities so that people are supported to home. And one of the things we've learned from COVID is how to help connect with families virtually. And so it's been excellent to see the development of programs like the I Interact North program out of Sick Kids to help support parents at home in their journey with their children.
That's really great to hear, and to know that that kind of support can be right at your fingertips just by using some online resources. So I think it helps keep people connected, feeling like they have more access to healthcare than before all of these online supports were in place. So I think that's really great for families to be aware of.
And also to be aware that there isn't a single response, right? That there are multiple members of healthcare teams that could support a child's development. And so I think it's really about a conversation with your healthcare providers to understand what would be most helpful. And Amanda, to your earlier point about these changes over time, what would be most helpful at what point in time?
Yeah. And just kind of continually voicing those concerns to your healthcare team as a parent or a family member looking after someone with a neurodevelopmental condition. I think kind of doing that as on an ongoing basis on in a dynamic way, as you mentioned, I think is important, and just keeping your healthcare team up to date as to what kind of changes are going on, and if your needs are different than they were the last time you talked to your healthcare team.
And not just concerns, right? I think it's important. We all take pride in our children. We like to brag about our children.
Yeah.
Come to the clinic and share those successes with your healthcare provider, because
Yeah.
I know that they will share those successes with you. So, you know, help our teams recognize your child's strengths, uh, even if you're coming to also discuss concerns.
For sure, for sure. And I think it's great to end off on a positive note, and to celebrate the resilience also in this community. I think there's a lot that we talk about that's, very medical, very, terminology heavy, and kind of get bogged down in the details of that. And I think it's important to kind of recognize how much resilience this community has, and how they will continue to prosper and lead amazing lives, with the help of their healthcare team.
The most important thing I've learned from working with children, youth, and families with congenital heart disease is hope. And so I want to acknowledge and thank everyone who's listening to this for that teaching.
Yeah, I agree. I think it's a community filled with a lot of hope, a lot of unity, and I just hope a lot of people can continue to share that message. So, from everyone from CCHA, thank you, Dr. Miller, for joining us today. It was a pleasure.
Thanks again for having me.